But from your experience, from your personal experience of someone that's practiced in Nigeria and someone is practiced outside Nigeria, now what's the experience like? And again, the issue of brain drain, how can government curb brain drain in Nigeria? How can we government retain the best hands to stay within the country?
I would just start by saying, being a medical doctor, to me, that's why I'll personalize it. To me, it's more like a call to service, and it's a whole lot um beyond the money that you get from it.
Hello, everyone. I hope you are already subscribing to our channel. If you are not doing so, please hit the subscribe button now. Together, let's build a healthy community. Follow Health-Panorama on YouTube.
But however, I think to compare both in my few years in Nigeria, practicing was not really comfortable because you could not probably the money that you get for salary sometimes is not really it's not obtainable like anywhere in the world. I think the government really did not really put a lot of funding into the health aspects because you will notice that the reason one of the key things that doctors are really leaving is because everybody really wants to be able to afford the at least the minimum things in life. But looking at the whole thing in Nigeria is a little bit stressful because we don't have doctors and more doctors are leaving due to the Japan syndrome. More doctors are leaving. So you can see that when they make those statistics, it's like one doctor to 100 or to 1,000 patients. So that's a lot. That's overwhelming. And after you're done, you don't, most times you also get the nagging fact that the patient is coming, he doesn't have money, there's no social amenities ready to probably take in the person. So it's a little bit stressful to practice in Nigeria. That's the truth. You do more of, how would I put it, crude medicine. We use more of our acumen, knowledge, as compared to doing tests. I was surprised when I came in here, and just because they wanted to test just one thing, and because you know that is the government that is paying, as compared to Nigeria, that most times they are paying out of pocket, and the ones that the government is paying for it NHIS, which can only afford just the basic, even the basic, you can't do some basic tests. As compared to this place that is the government that is doing everything, they did about, if I should not exaggerate, they did about 25 tests, all because they really needed to just do something. Now from there, you won't be able to miss some important information about diagnosis. It's not really about you, like some people will argue with you, they'll tell you that typhoid, you should be doing wider test. Nobody is doing wider test again. Nobody believes that there's typhoid. Even though there is typhoid, it's rare, it's not common, like the way people, once your body is hot, you're having a headache, the next thing you start giving yourself self-treatment. Yeah, before they will start you on antibiotics. That means that something is really, really wrong. So both both places for you to study medicine is challenging, but there's one that is accommodating, and probably the government is putting a lot to cater for people as compared to Nigeria. A lot needs to be done as regards the government just doing the needful to people. So at least people that don't have money will be able to afford care and to be able to just seek guidance as needed. So the two is overwhelming, but one is more accommodating and more economic friendly. You earn what you work for, and in Nigeria, it's, it's not the case. That's why you see even consultant is running professor in medicine is running to the UK, running to the Saudi Arabia, running to USA, Canada, just to seek a livelihood.
I started practicing before I moved over to the United Kingdom. When I was in Nigeria, I did a couple of work. I trained in a teaching hospital, so I know what works in the teaching hospital as a thing and how the nurses work and all before working as a research and working with a research firm, I would say. And then late are doing care home jobs, or we call it home care jobs as a nurse. Really, the experience was not very good, because with Nigeria, it's a lot of, sometimes people expect you to do things which are not directly your responsibilities. It's just like there is no clear interpretation of roles in Nigeria. A nurse is expected to a nurse can do this, a nurse is expected to take blood to the lab, a nurse is expected to react in some particular ways when the consultant is there, a lot of things really, which now if they ask me, can you stay in a place where this is happening, I will tell them no. But back then, well, even though I couldn't stand, I had so many issues as a student nurse while training. And also while I was doing home care nursing in Lagos State, I had so many issues also with people, because these are things I can't stand. I couldn't stand then. It's just me not being able to stand it. But when I moved into the United Kingdom, I moved into what I would call the actual nursing practice. When I mean the actual nursing practice is I am expected to work solely as a nurse. I won't get punished for probably not greeting my matron. I won't get punished for probably not greeting the consultant. I won't wait for the consultant to get there before I'm able to do things for my deteriorating patient. Even as a junior nurse, when I was a junior nurse, I won't be there. I won't be there while my patient is dying and I'm just doing CPR. So there is a pathway for things, and that makes me feel more fulfilled as a nurse. Unlike there, doctor is not here, we cannot put in cannula. Doctor.
Time will not permit us to do more than this today. But this is a conversation that I'd love to repeat it one more time. But until then, you've heard why our doctors are leaving. You've heard why nurses are living in drones. You've heard the reason why our best brains are leaving. How can we reverse this trend? How can we just reverse this trend? How can we attract the best of our healthcare professionals to stay? Until next time, when I come your way again, I remain yours sincerely, that your journey. Saying bye for now.